Welcome to The Blend, a podcast brought to you by the Journal of the Dermatology Nurse Practitioners and Physician Assistants. In this episode, Dr. Sonal Choudhary and physician assistant Noel Prevost discuss how consuming dairy products and excess sugar can contribute to or exacerbate acne, especially in women with polycystic ovary syndrome.
We know that medications are not everything, and we have to look at a patient in an integrative, holistic manner. So I want to welcome Noel to this podcast today and let her introduce herself, and we'll begin with more questions. Hi, Noel.
Hi, my name is, again, Noel Prevost. I'm a physician assistant at the University of Pittsburgh Medical Center. I've been doing dermatology and focusing primarily on acne, probably for most of my career. I was appointed to run the Accutane clinic right when the iPledge program started. When I first started, it started as a SMART program, and then it became the iPledge program. So I have seen a lot of acne patients. I've seen a lot of trends, and with those trends, I now, as more and more research is coming out, I can back the trends that I've seen with data.
Well, what other dietary things do you talk about to your patient? Like, I don't want to give you leading things here, but I know that you have yourself told me so many times about the lattes that the patients will, be drinking, and you highlight that for them, or the Greek yogurt. Like, tell us something about some of the examples you have dealt with in your patients, and how do you counsel them to avoid that?
So good question. So again, it goes back to like HPI, getting a good history on these patients to determine, what are the things that they're doing that could potentially be impacting their skin. So one of them so when they come in, I'll ask, are you drinking or eating any dairy? And so a lot of times they will say, well, I do, but it's not that much. I don't think it's that much. And so a lot of times, once I dive into that, I do discuss, are you drinking skim milk? Are you drinking whole milk? Like what are the things that you're drinking? And a lot of times they do, they're drinking skim milk. And so I get into, with skim milk, what we're finding is that in skim milk, when they break it down, you have insulin-like growth factor, which is in skim milk. And then when you ingest it, we also have insulin-like growth factor. And then when you're also ingesting it, it's increasing this in your system. And as a result, it definitely can increase all the potential processes that cause acne. So increase sebaceous gland activity and increase hyperkeratosis and inflammation and things like that. So this is something to really kind of discuss about, with your patients, so they are aware of what's happening. Now, having a glass of milk here and there is not a big deal. I kind of try to figure out, are you drinking milk every day? Are you also eating yogurt? I've had a lot of patients where, they are saying, I had one in particular, she came in and said, oh, I never had acne. And then just recently I really started, trying to eat healthy. I eat yogurt in the morning and, I eat it daily. And I said, well, do you eat any other dairy or drink any dairy? And she says, no. So I said, well, let's try to, I think it's probably the sugar in your diet or in the dairy yogurt than anything else. And then as you go into the literature, I'm finding more of that with, in particular, Greek yogurt that is, non-fat Greek yogurt has is also broken down similar to skim milk, and that also has insulin-like growth factor. So now looking back, I'm thinking it could have been the combination of the sugar that's in a lot of these yogurts, because in these yogurts they have, on average that I've seen, 6 to almost 9 grams of sugar. And so, but looking in the literature, they're finding, in the studies, some of the studies show that the average dairy that we're ingesting mainly it's from milk, but it's skim milk or fat-free milk, and then it's flavored fat-free milk, and then it goes into non-fat yogurt, Greek yogurt, and then non-fat cottage cheese. So these are things that I didn't really think about, but now looking back, I'm wondering if that was one of the triggers. It was the insulin-like growth factor, probably along with the sugar, that may have triggered this patient's acne, because after 8 weeks of just purely discontinuing the yogurt, because she did not want to go on any medications topically or systemically, she completely cleared. So that's something, again, this is anecdotal, but I'm seeing more and more in my patients who are ingesting dairy, that they are seeing, significant improvements with their acne without using any systemic or oral or systemic or topical treatment. But the other thing to think about too, a lot of times with these patients, when they're on isotretinoin. So if you're treating them with isotretinoin and you're like, why are they not clearing? Because 95% of patients on isotretinoin should absolutely clear. Only 5% will not react, not get any improvement, which I haven't really seen a lot of those patients, maybe a handful in the 20 years I've done this. But there was a patient in particular, an Asian patient, was on 4 courses of Accutane on the 4th month, which at the 4th month, you should be mostly clear. And I just did not understand why he was not clear. And as I went in through a lengthy discussion, I'm like, are you drinking any dairy or eating any dairy? And he's like, yeah, I'm actually drinking about 1.5 gallons of milk per week. And so I was like thinking about that. And I said, let's stop. Let's not change any variables. We kept everything the same. He came back a month later and he was completely clear. So, and I post Accutane, I advised him to avoid specifically skim milk, because that's where they're finding the insulin-like growth factor. So I told him to avoid skim milk in that situation, because it seems like he's definitely reacting to that. And he did well post Accutane.
That is exactly, again, like I said earlier, was my experience with my patients. Dairy is such an important one. And I would say, if somebody is a heavy consumer of sodas, and whether, obviously the reduced sugar sodas are probably a touch better in that regard. But honestly, if it's a lot of carbonated sugary drinks, that's another thing that I tend to ask patients about. Or in general, just sugary food consumption. Rarely I would find 1 or 2 people who are actually eating candy, but it is hiding in the form of other easy, simple sugar food, like bread and pastas. And I know that you often ask your patients, do you eat a lot of bread or pastas? I've heard you talk about it on video visits too. So I know you do ask that. Just jumping onto one more thing here is, what about the polycystic ovarian syndrome patients? There's definitely a much stronger link that I have known from research as well between how sugar consumption, maybe even dairy consumption, and acne is. What is your experience with that? And what is the data that you often will share maybe with your patients?
So with my polycystic ovarian syndrome patients, their type of acne tends to be pretty recalcitrant. And so even with isotretinoin, they do okay, but post isotretinoin, they tend to flare. And a lot of times it's kind of hormonal. So I do make sure that they're on a birth control pill. And a lot of these patients, I don't necessarily jump right to isotretinoin. I a lot of times will say spironolactone is the way to go. And a lot of times they do extremely well with the spironolactone in combination with the birth control. But I also talk to these patients about, are they consuming dairy? Are they consuming sugar? And what's really interesting, and to put it in perspective, and I actually just grabbed one of these on the way here, but with Starbucks, a lot of their drinks, and it's all published, all on their websites. For instance, I just got a pumpkin spice latte, which is one of my favorites. I got grande, and because of my lactose intolerance, I got an almond milk, and I feel good about myself about the almond milk. But the problem with this, the sugar content is about 54 grams of sugar. So to put that in perspective, you're only supposed to have, like back in the day, the food pyramid, you're only supposed to have around 10 grams of sugar, okay, per day. We're eating and we're drinking and eating way more than 25 grams of sugar a day. In particular, I had a patient who, 55-year-old female, comes in with new onset acne, never had it before, no changes in medication. And the only change change was that she started drinking ginger ale. And I was like, okay, so I mean, that shouldn't be doing it. So as I continue to question her, she said that she drinks about a 2 liter every other day. So I said, okay, hold on. So start calculating the amount of sugar, and it's around, I think it was like 179 grams of sugar for a 2 liter bottle of ginger ale. So after I explained this to her, she was shocked. And then sure enough, she completely stopped. And I said, just go drinking like seltzer water or club soda. She came back, was completely clear. So with PCOS patients, they're a lot more sensitive to dairy and sugar. And I'm suspecting maybe it's the insulin-like growth factor that could be kind of promoting this and causing like hormonal changes. So I do really emphasize reducing dairy and sugar. I do recommend or refer them to an anti-inflammatory nutritionist so that they can do a diet journal to determine, what are they ingesting and, how much sugar are they ingesting and how much dairy? Because again, we all think that it's like, oh, it's nothing. Let me, for instance, like a pack of Oreos, a 6-pack, I think averages around 25 grams of sugar. And then if you're like, oh, I'll have a Dr. Pepper, that's another like 30 grams of sugar. So in one sitting for a snack, you're looking at almost like, 60 grams of sugar. So that definitely has to have an impact on us, particularly from an inflammatory perspective, and then, in some patients causing acne.
Thank you, Noel. Those are all real examples that I think we all come across. Sometimes we don't ask these many questions, but there can be answers. And, asking these questions, you can really make a big change. So I want to give a quick summary here. Dairy is already a pretty well-known, well-studied inflammatory factor for a lot of people with acne in all its forms. Especially today, we learned that, the Skim form is definitely one of the higher ones, even if it's yogurt, even if it's whey protein. Sugars in all of their formats can be pretty aggravating for acne. One thing that we didn't go in details, but we do know, and we have discussed it before, is that fiber or higher fiber diet can counter some of these things, and by itself can actually make acne, reduce the acne lesions. There are a lot of other integrative techniques that we have discussed previously, which can be combined with these dietary changes to bring about a major change in a person's health and not fully rely on medications. But having said that, I think medications do matter. And we have covered a lot of the medications in details previously and had left some of the important ones, such as isotretinoin and its details, for another episode. So stay tuned because we're about to discuss that in our next episode. Thank you.
Thank you.
We hope you enjoyed this episode of The Blend. Thank you for listening. We'll see you back next time.